Hey everyone, what better way to start a video than cat butt, right? Alright, so I hope everyone had a really awesome week. Thank you so much for being excited about my channel and letting me know that you guys have watched it and you really liked the information that I told you. So for this week, I was asked by a couple different friends about what my experience is as far as going into situations where I know the subject of me being trans is going to come up and how do I handle it. Specifically, one person had asked how I handle like medical appointments and stuff like that. So like where I work, it's a primary and urgent care, and I have been seen there before. So it's easier there because they already know. They're really super supportive, so I don't have to worry about that, and kind of so to speak, out myself just because they already know. When I first came out as trans, I go to the VA usually for most of my health care. So when I started talking to my nurse practitioner that I see, who is my primary care, about getting on testosterone, I had waited a little bit to see kind of how she was because I had just started going to her for like a few months before I decided that I wanted to go ahead and start testosterone. So I kind of gauged on how she was going to react because you don't always know. Even if people are nice and sweet, you don't always know how they're going to react to something like that. So I kind of just gauged the situation, and then I finally brought it up, and I was like, hey, so I'm transgender and I wanted to start testosterone therapy, and I was wondering if the VA covers that. Like, what kind of things do I need to do? And absolutely, like, she immediately gave me the number to the endocrinologist at the Richmond VA, who specializes in transgenders and stuff like that. So for me, I will say my experience has been a little bit easier. I've never gone to a doctor or wherever, or somewhere where I've had to out myself and had a negative experience. Obviously, that's not the case for everyone. That's not, a lot of people deal with the medical community misgendering them, especially if they haven't had their name changed or their gender changed yet. I was really lucky before I even had my name changed. While officially on documentation, on records and everything, I did have to use my previous name. They still in the office referred to me as Ryan and used male pronouns. So, I've been extremely lucky, and I don't take that for granted by any means. I'm not, I try not to discount what other people have gone through. When people tell me stories about things that they've gone through, I'm horrified, because I can't imagine going through those experiences. So, well, that is a great question to ask. I specifically have not had to deal with it. The only thing that I've had to deal with that's been very difficult for me is because I still have female genitalia. I still have to get pap smears. I still have to get breast exams. Not for very much longer. But I still have to go through those experiences. I recently had to get an ultrasound done on my kidneys, my bladder, and also a transvaginal ultrasound. Because I've been having some issues, and luckily they all came back normal. But for that last one, for those of you who don't have that genitalia or have never had the ultrasound done, that's something that goes inside. So that was very, very awkward for me. It was very uncomfortable for me. But the ultrasound technician who was there with me, she was extremely respectful. She was like, take your time, and like, we can go as slow as you need to. She was like, if it ends up being very like too much for you to bear, we can skip that part. It's not it's not an absolute. She was like, I prefer that we get it done because you can get better results and better views and stuff. But she did give me that option that if I felt uncomfortable or extremely dysphoric, that I could stop at any time. So going to those kind of procedures and having those kind of appointments, it is difficult, but for me, I just have to go into it from, that rational medical standpoint of, this doesn't mean that I'm a woman, this doesn't mean that, this doesn't negate who I am. This is just I have to get it done, because while being on testosterone, your estrogen drops, and you also, because you stop having a menstrual cycle, like I haven't had one in a year and a half. So my chances of having ovarian cancer, uterine cancer, things like that, like cervical cancer, they all, the percentage, the chances of those go up exponentially while being on testosterone. So, that was one of the pushes. That was the big push from my nurse practitioner to get that ultrasound done. Was, this looks like it may be kidney bladder, but on the off chance it could be something related to this, I really, really recommend you get it done. And, I had to push that dysphoria aside momentarily, and just think of it as, I have to make sure that I don't have anything serious going on that could be potentially life-threatening. And, and that's some things that those of us who are transgender, we do have to face. We have to look at things like, is this worth going through the dysphoria that I'm going to go through, the uncomfortability that I have to go through? For me, yes, it was potentially life-threatening. Obviously, it was fine, it was routine, nothing ended up occurring, but there is that small percentage chance of, that it could potentially be something. I have a history of cancer, so for me, it was a no-brainer, like, yeah, I need to make sure and get on top of this, should something happen, so that I would say has been the hardest thing, until I get, a hysterectomy, which I do plan on getting. Other people have asked me, like, what, on the subject of medical procedures, people have asked what kind of procedures I'm going to be getting. Obviously, not people that I meet for the first time, they're like, hi, hello, how are you? Oh, you're trans, what kind of procedures are you going to get done? But, people that are very close to me, who I respect and trust, and know they're not just asking questions just to be nosy, they're legitimately wanting to know what's going to make me feel the most comfortable, and obviously top surgery is going to, was highest on my list, and is going to be happening soon. Hysterectomy is also on my list. One, because in order to, if I were to ever want to get bottom surgery, you have to have that done, and two, just to eliminate that risk of cancer is the bigger thing. I will opt to not have a full hysterectomy until I'm older, just because once you take it completely out, then you're on a balanced beam of hormones, because now your body is no longer producing estrogen, and all you're giving your body is testosterone, so it's kind of like a teeter-totter, like, am I going to become imbalanced and run the risk of anything medically happening? So for me, I feel like the better decision for right now would be just to get the partial hysterectomy, get the cancer producing organs, so to speak, out of the way. Obviously also ovaries, but get those out of the way first, and then go from there later on. I would like to get bottom surgery at one point. However, right now, with my career goals and the risks involved in the procedure right now, I don't feel comfortable doing it. It's a very, very long recovery as it is right now. And if something goes wrong, the potential for it to go extremely wrong, for me, is not worth how I would feel, if that makes any sense. I don't want to end up, guys end up with coloscopy bags. They end up messing up their urethra, they have bladder issues. There's a whole lot of things that can go wrong there, and I've seen that the guy, like, I've seen the guys that have done it, how they feel afterwards, and that is awesome for them. For me, I don't want to run that risk. I am a very strategic and calculated person when it comes to things. I made a pros and cons list before I even got on testosterone, because I wanted to make sure I was going into it 100% knowledgeable about my decision, and it wasn't based on an emotional decision, that it was also based on, I've looked through the possibility of what could go wrong and what could go right. And for me, at this point in time, bottom surgery, what could go wrong scares me more than, I'm a lot more nervous about what could go wrong versus how excited I would be for it to go right, if that makes any sense. That obviously could change as I get older and experience things, and the medical community advances in a lot of ways, but for me right now, it's just how I feel. I know I just totally strayed off topic from the original question, but that was another question that was asked to me, was what I planned on doing as far as physically transitioning to more look like a man. Um, so that's kind of where I'm at with that. So yeah, so there's that. I was trying to think what I was going to say, but the other question was asking about testosterone injections. So there's a few different ways that you can do it. You can do testosterone gel where it's applied daily to the skin. You can do, some guys get injections every other week. Some do it once a month, I think. There's little pellets that you can get embedded that stays in for 4 months. I do the once a week injection. I do it IM. Some guys do it sub Q, even though they have not talked to their provider about it. My doctor specifically has told me to do it intramuscular, and I listen to her. So yeah, there's a few different ways to do it. Every dose is different. You get blood work done. When you start out, it's everybody's different. My endocrinologist had me doing blood work once a month for the first 3 months just to make sure everything looked okay, because when you're on testosterone, you run the risk of your liver values going up, your cholesterol going up, your kidneys and all of that. So it's monitored very closely for the first 3 months to make sure your body's not reacting negatively to it. From there, you do every 3 months. She had me do it every 3 months for 9 months, and then now I am on, as of January, I'm getting my blood work done every 6 months, unless there's an issue or I feel like I'm off or any kind of way, then I'll go to do it sooner. So yeah, that's pretty much it. Things that change on testosterone, obviously facial hair, your voice gets lower, you start to grow hair other places. Some guys have said that their feet get bigger. Mine haven't. Not that I've really noticed. I have very teeny tiny feet if you have seen me in person. Other things that can happen is you have an increased sex drive. You kind of go through puberty, so you go through instances where you're just really tired all the time, and also where you get really hungry. So a lot of guys, I had some weight gain just from eating a lot, which I try to counteract and balance with going to the gym, which obviously you get increased strength. It's easier for you to gain muscle and get defined muscle. Excuse me. Another thing that people don't talk about, which I'm a little bit on the fence about because my family watches this. So you do get what we call bottom growth, which is basically where your genitalia enlarges to look more like a man, like a male genitalia. It's not obviously significantly much, but it does get bigger. Yeah, so that's basically it. There are some facial features that change because your fat is distributing into different areas. So, like for me, my breast tissue has gotten a little bit smaller, but my gut's gotten bigger. And some people it's just a matter of genetics and things like that. So, yeah, that's pretty much it in a nutshell for what I wanted to talk about. I will just shout out, just because while I was making this video, so in one of the trans groups I'm in, we have a mentorship program, and I mentor a guy, and he just messaged me and said that he just got approved for testosterone. His first injection is on Monday. I'm really, really excited for him. I think it'll be really, really great for him. So, it's things like that just really make me happy. Is just seeing somebody else start the journey, and being able to be there for somebody as they walk through it, because I was lost in the sauce when I first started. Like, I didn't know where to go, where to turn to. A good resource for those who want to know more about the process is called the W Path, and that basically is an outline for both transgender men and transgender women who medically, it's the medical requirements for if you want to go through, because there are like informed consent clinics, there are surgeons who do stuff where you pay out of pocket, but if you want to go through like insurance and stuff like that, it goes through the process as far as what kind of letters of recommendation you have to have, how long you have to be on hormone therapy. It goes into all of the benefits and risks of hormone therapy, through the changes that you could see. So, if you have time and you really want to learn more about, kind of some of the stuff I talked about today, you just go through there and just kind of read it. So yeah, that's it. So if you have any questions or anything you want me to talk about next week, just shoot me a message and let me know. I'm really stoked about this. I think it's really cool that people have subscribed to the channel and are watching out for it. Like it's pretty cool. Little me. But yeah, I just want to say thanks again for everybody's continued support. I say it a lot, but I'm daily blown away by how amazing the people I have in my life are, and how supportive they are. Because like I said earlier, not everybody has that, and there are a lot of struggles in the trans community, and to be one of the unfortunately fortunate ones who haven't had to face too much, I definitely don't take that for granted. Each and every day I wake up, I know that I am blessed beyond measure. So yeah, I hope everybody has a good weekend. Be safe, make good choices, and I'll talk to you guys later. Bye.